Good afternoon, everyone. I welcome you all to the launch of the 10th edition of the Future Health Index Report, the world's largest healthcare survey on the evolution of healthcare. Today, this is presented by Philips in collaboration with the Economic Times ETHealthworld. And to begin, I would like to invite Her Excellency Marisa Gerards, Ambassador of the Netherlands to India, to launch the report. Please come up.
Yes, thank you very much. Thank you very much. And namaskar, ladies and gentlemen. Very happy to have you all here with us. Warm welcome to our residence in a historic villa. This was the house, the home of Mohammed El Jinnah, and many important discussions took place in this house on nationhood. And now we gather here today for other very important discussions that are going to take place, different discussions. We're going to launch, as you said, the Future of Health Index Report 2025, the 10th edition commissioned by Philips, and this year it's focusing on a very important issue, building trust in healthcare AI. And AI, autonomous intelligence, it's already part of our everyday life. We all have a smartphone. Some of us have a smart watch. I even heard about the smart ring. And I had someone visiting this house with smart glasses who could make pictures and record everything already. So AI is part of our life, and we know that. Now, it's not only part of our society, but it's actually also part of health and part of healthcare. Digitalization and AI in particular. It can support patients, it can support health workers, professionals, also informal caretakers, citizens as well. And I even have been told that it's possible to deliver so-called warm care that we're used to actually get from doctors and from nurses. So it's quite exciting, I think, today, to talk about the potential of AI and to talk a little bit more about the increasing breakthroughs that we see day by day in the health domain as well. Now let me give you a few examples that I was impressed by. Now let's think, for example, of the use of data from our general practitioners that we all go and visit on a daily basis. With these data nowadays, you can predict a diagnosis, for example, of lung cancer far earlier. I've heard 4 months earlier even, and in that sense, it's actually a true lifesaver. Now another example, AI-generated treatment plans for breast cancer. These plans are actually more efficient, they're saving time and energy, not only of the healthcare worker, but also of the patient. So that's another example. Now another major benefit is the use of generative AI. It can enable our healthcare workers to actually simplify the administrative work that they're doing. With this AI, we can actually save 40% of their working time. That's just amazing. That's such a high number, 40%. So no wonder that our Minister of Health in the Netherlands is very interested, and she would like to introduce, through generative AI, she would like to actually reduce the administrative burden with 50%. So instead of 40% of your working day dedicated to administration, it would be 20% in 2030. I think that will be a great gain and a great benefit. Now, is it only benefits? Maybe yes, maybe no. We get a panel, they're going to discuss it. And trust, it's all about trust. Because the healthcare professional, of course we need to trust the healthcare professional. We patients, we're so vulnerable, So it's therefore very important that our healthcare workers, that they're sufficiently trained in AI, skilled so that they can use it in the best way possible, but that they also learn how to be transparent about AI, so that we as a patient, that we know when and how it is actually used. That gives us actually the trust that we need. And I'm confident that our very able and distinguished panel, that they will go into these kind of questions. And I have a few more, if I can. Because they're not only questions, but there are also some concerns. And let me mention two. Because all of us, I think, we are concerned that how far can we go? How far can we go in letting AI into our world, into our lives, without losing the direction and actually the control of human intelligence? That's one question, I think. And the other one is, how are privacy and patient safety, how are they actually safeguarded? How can we actually trust it? Well, these are all my suggestions for the panel to be discussed, because they need answers. They need answers in order for us to actually fully reap the benefits of AI in the health domain. And those answers, they must also be discussed and formulated in an international arena. Because we know AI, but also health, it doesn't know any borders. So we actually have to discuss it and agree on it. And therefore for us, the Netherlands, and for India, it's a very important subject that's been discussed and where we work together as well with our team. So the title of this year's Future of Health Index Report 2025, I think it hits the nail on the head. The title is Building Trust in Healthcare AI. Now indeed, and now I will quote from the report, as AI transforms healthcare, trust and innovation must go hand in hand to bring life-saving solutions to more patients and providers and to deliver it faster and with the right safeguards. It's a good quote, I think, from the report, and it will be central, I think, in the discussions as well. So I'm looking forward to a very inspiring session on such a meaningful topic, our health. Thank you so much here in the audience, but also at home or at a working place when you are actually watching us. Thank you so much.
Thank you so much, Ambassador. If you could just stay on for a bit more, I would like to call upon Bharath Sesha, Managing Director of Philips Indian Subcontinent, to present the report to the Ambassador. Thank you so much.
Congratulations. Thank you very much.
Right. And with that, now Bharath is going to be presenting some findings from the report for us, and then we carry on with the rest of the agenda.
Hello. Honor and a privilege to be here. Thank you, Ambassador, for hosting us for what is a very important day. I'm going to talk a bit about the background of this report before I talk about what is in the report and why is this important for us today here in India. So if you could look at the report, if you go to the next slide, please. This report is the 10th edition. It's a decade that we have been doing this at Philips. We talked to almost 18,000 healthcare professionals and most importantly, 16,000 patients. That's very important. Both are extremely important stakeholders for us. We do it across 16 countries. It's a one of a kind and the largest global survey that we have. And this year, as the Ambassador pointed out, the topic of AI is the theme for this survey. Go to the next slide, please. You can see the countries in which we've done this survey. It's across the world, so it's truly representative of what the thinking is from healthcare professionals, from patients today about AI in healthcare. Next slide, please. There have been various questions that this survey has addressed and various topics that it has touched on. And you could see the kind of progress of the topics as we went through the years. And you could see that it has evolved from talking about resilience, sustainability, innovation, and new care delivery models to AI. This progression, in many ways, is the progression of the healthcare questions, challenges, and opportunities that I've had over the last decade. And this report now is very uniquely positioned to address the biggest topic that's on the mind of many stakeholders today, which is what is the role of AI in healthcare? How can it be used productively and beneficially for patients and healthcare professionals? So with this context, let me give you some remarks about this report. In India, healthcare is currently at the cusp of a transformation. When I say this, many times I get the question back, what do you mean by that? What is transformation? Why do you say we are at the cusp of this transformation? And I always like to think of analogies to explain where we are. And for me, the closest analogy that comes to mind is the transition we made as a country from having landline telephony to mobile telephony. This transition that we made as a country happened because of a leapfrog in technology. It didn't come from laying thousands of kilometers of cable to connect all of us. Healthcare today is poised at such a point where technology can catapult, can leapfrog access to care. And this analogy for me is very important because we were able to solve the challenge of access to communication in the country. And I think AI can be an enabler, can be an accelerator to change the dynamics and to have the capability to provide access to care for the country. Now, for any of these type of disruptive technologies to take hold, three things need to happen. First is a need, second is a trust, and last but not the least is the capability. Let me talk about all these three parameters as we see them today here in India. Let's talk about need. I think none of us can deny the fact that the need for healthcare is currently something that we need to fulfill. It's not where it should be. And let me talk about it from two perspectives. How can we bridge this gap? Because our clinicians, our doctors in India are some of the best in the world. They could walk shoulder to shoulder with the best doctors in the world. We need to make sure that they have the right information at the right time to be able to provide that world-class care. To bridge this gap, there are two essential ways to do it, and they're complementing each other. One is to invest in infrastructure, in hardware, in equipment, more MRI machines, more CT machines, more ultrasound machines. Absolutely important, and we are doing that, and we should continue to do that as a country. The second, and for me equally important and complementary, is literally out of the box. How can we make an existing equipment be more productive, more effective, more efficient? And an example is that in Philips, we have a technology called SmartSpeed, which we use with MRI machines. The beauty of this is that with the same existing machine, we could scan up to 5 patients more a day compared to without that solution. That's 5 patients getting access to care in every MRI machine in the country today. That's the power of AI. That's the power of technology. Talking about trust, which is the second element of this disrupting that we need to look at. And this survey talks about, then there are 2 numbers in the survey that are very important for us to keep in mind. 76% of healthcare professionals are optimistic about the use of AI in India. 76%. The global average is roughly around 79%, which means there is a welcoming environment for looking at AI as a transformative tool. But for me, what stood out is not only this. 79% of patients are optimistic about the use of AI for the future. That's really heartwarming. That's really telling us that people are ready. They want to see more care. They want to see access to technology. And what is even more interesting is the global average of patients who are optimistic is 59%. As India, we're 20% above the global average when it comes to patients' receptiveness to AI, optimism about AI. Great foundation to build on. And the last part is to do with capabilities and capacity to be able to leverage the needs and the trust into something that's purposeful, mindful solutions. And there, I can talk very proudly about Philips that we have invested in bringing our hub of innovation when it comes to software and AI here, right here in India. We have manufacturing and R&D in Pune. We have software AI innovation for the globe that is done out of Bengaluru. 7,000 people between these 2 sites are working day in and day out about innovating and bringing solutions based on AI and software, not just to India, but to the world. People ask me, do you make in India? And I say, yes, we do. But equally important, we create in India. And we create in India because our purpose as a company is to provide better care for more people. And I want to end on a very optimistic note. I have traveled and met healthcare professionals across our country. I have been a patient myself. I have family members who are patients. I can only say this: the level of optimism, the level of positivity towards technology, whilst balancing it with the concern about whether I will see my doctor, should I have to talk to a machine instead of a human being, all these are addressable challenges that as a sector, as an industry, as society, as the ecosystem that we have, can address and lead to a solution. And for me, that in the essence is why we are here together today. And I look forward to discussing that and more such nuances with my eminent co-panelists. We're all here to provide better care for more people. Thank you.
Thank you so much, Bharath. With that, it's now time to discuss the report more in detail. And for that, I'd love to call upon our panel. And if we can also go to the next slide. Let's call upon Dr. Ratna Devi, board member, IAPO, CEO of DakshamA Health. Mr. Neeraj Jain, Director Growth Operations, Asia, Middle East and Europe for PATH. And Pratibha Raju, who's our moderator for today, Senior Assistant Editor for ETHealthworld. And now I leave it for Pratibha to moderate the panel and have a discussion with our panelists.
Thank you. Hope you can hear me, right?
Yes.
Yeah. So as Mr. Bharath has given the introductory part about the report, and I think I have a right mix of panelists over here. What more I should ask for? I have some questions and you answer, and we all know about the report more in detail. We have a tech expert, we have a public health expert, and we have a patient advocate here. So as we have just unveiled the report, it's the 10th edition of Future Health Index 2025, which rightly put as building trust in healthcare AI. So the optimism is there. So it is accompanied by caution, I would say, if I also had gone through the report. So the report highlights the critical trust gaps like fears around reduced human interaction, which is always we want to go to a doctor. If the doctor comes in, touches and feels how we are, like, that is what we wanted. And if AI comes in, what will happen is most of the question, any of the patient's mind, right? And the lack of clarity on liability and concerns about data bias in AI-driven decision-making. So let's begin the discussion today, and also let's reflect on this paradox of high optimism and underlying hesitation. So let me throw the first question. I will go to Mr. Bharath first. So as you've already given few remarks, maybe you can just give another perspective if you have. So from your perspective, what does it take to truly build trust in AI-driven healthcare among both patients and professionals? And how can India lead in demonstrating responsible, inclusive AI adoption at scale?
Yeah, thank you for the question. It's a very important one because everything has a downside and we should be mindful and careful about it. A couple of interesting data points came from the survey, right? One of the data points was that 2/3 of the patients are concerned with the exact same thing you mentioned, Pratibha, which is I need to talk to a human, not a machine, when I go for care. At Philips, the guardrails are very clear. AI is augmenting and enabling care. It's not replacing a clinician. Our fundamentals of innovation are about making sure that they are patient-centric, A, but B, they are about enabling care. So I think the best way to address this challenge of, I want to speak to a human, I want to feel cared for, a machine can never replace that emotion. The best way to do it is to always use AI as a tool to enable, not to replace. And that has always been our philosophy in terms of innovation at Philips.
Good to know that. I'll go to Mr. Neeraj, your points, sir.
Yeah, I mean, I work in public health, so I'll come from the health equity perspective. So firstly, AI is here to stay.
Yeah.
We are, especially if you look at low and middle income countries, we have issues of access to healthcare, essentially because we don't have enough trained people who can actually provide that care. Is that going to replace human beings? Absolutely not. However, as Bharath also sort of alluded to that, there is We did, I'll just go back to an example. We actually did a trial of an AI solution way back in 2017. And we had a huge pushback from radiologists. They didn't want to touch it. They thought that they're going to lose their jobs, all of that. But what we realized was, as we continued the conversation, and we realized that if you are using it as a screening and a triaging tool, the radiologist was okay with it. So you're actually triaging, you're just providing that radiologist speed, more accuracy. You're also able to reach many more patients which you couldn't have if you were purely relying on the clinicians. There is a trust issue for sure. And I think the report is wonderful. It's brought out some really good nuances, and I'm looking forward to actually dive into detail. For this session, I just quickly had a look, but I'm really looking forward to it. But I think, if we think about health equity, if we think about population level screening in a country of 1.4, 1.5 billion people, there is no way to do it if you're not going to adapt to AI. Just one last point. We are thinking about AI by itself. The system has to be ready to accept it. So is the hardware in place? Are the digital systems in place? Are we trained? We've trained people. Do they understand what it means? I think those are important pieces. I mean, we are now screening for cancer, for cervical cancer in the remotest parts of India using AI.
So we have all been talking about trust, ma'am. So you're the patient advocate here. So if you can, touch upon the trust aspect as well. Over to you.
Thank you. And first of all, congratulations on the launch of this 10th report. Having said that, I had not heard of this report. So this is the 10th edition, and I have not heard of the first 9. And since I'm wearing the cap of the common man on the street, it says a lot about how much the common man understands AI. And usually AI is seen from the provider side or the health system side, not so much from the user perspective, because the design is meant to augment the tools within the healthcare system. But I was very interested to learn that the patient perspective was also taken. There were 16,000 patients who were asked the question of how comfortable they are with the adoption of AI in healthcare. And the results are positive. But it would be nice to know what is the profile of these patients and whether they were more literate, urban-centric people or people who are in the villages. So having said that, if I am an educated person who has used apps, who understands what healthcare system is, I will probably be positive about it because it improves my access to healthcare. And there are a lot of chatbots and other AI tools that are already in use, and usually insurance agencies provide you with apps that scan your face and tell you whether you have hypertension, etc. So that part of it, there is a lot of adoption because it makes my life easy. I don't have to go to a hospital and take an appointment. And I know that if I have a risk, then I have to book an appointment with the doctor. I know that the reliability is limited to a preliminary diagnosis or a risk factor assessment, not the treatment side of it. So that trust is still there. But having said that, AI has the propensity to change human behavior. So the worry with people who do understand how data is used is, will this be used in a negative aspect? So will there be fear built within patients saying, you know what, you have these risk factors for cancer, you need to have a diagnosis, or you need to go for screening every year. And is that going to increase my health expenditure? So that's the worry they have. The doctor-patient relationship, I think, will not change much because for maintenance, for remote monitoring, for follow-up, AI is very good. But for the initial diagnosis, you have to visit a doctor, especially for critical conditions. AI can never replace the doctor's touch or the doctor's intelligence. What you're taught in medical schools cannot be built into an AI system. Also, when you are a doctor, and since I am a physician, over the years, you build clinical acumen that cannot be replaced by a machine. So that trust factor will be there. It will take some time to build that trust factor. For remote populations who do not understand, the trust is inbuilt because whatever is easy to trust. And they do not understand the pitfalls of data violations or data breaches or unethical use of health data, etc. So till that health literacy is built, trust should not be a problem.
Yeah. So going on, but one thing I would like to say about AI, which is helping, no need to decipher the doctor's prescription. They're all giving electronic generated prescription, so we can read it. So going on with that, so let's talk about the AI optimism and potential in India. So to Mr. Bharath, the report shows that 76%, you had said, of healthcare professionals in India are optimistic about AI improving patient outcomes. How is Philips aligning its technology roadmap to meet this growing confidence and readiness for AI in healthcare?
Let me start with the statistic that was not so positive from the report, which was less than half the physicians, healthcare professionals feel they're not involved in the development of AI solutions. And that's an alarm that as an industry we need to pay heed to. At Philips, any solution we develop in consultation, in discussions with a clinician. We have clinicians on staff. We have clinicians who work with us on technology, on innovations. And they not just help us and support us, but they challenge us. I've been personally in workshops where clinicians have come and said that this is not the right approach. This is not the problem that we want you to solve. Look at it from this perspective. So this constant interaction and iteration that we need to have with clinicians can never stop. And for me, the biggest takeaway of what we need to do different as an industry, and we as Philips take this very seriously in working on this, is to involve clinicians in whatever we do in terms of innovations on AI. No one understands the caregiving point as much as a clinician does. And they deserve and they have a right to be included in any innovation efforts that we are doing, and we do that at Philips. And we will continue to do that and maybe even speed and accelerate that up so that we could address this one pain point that we found in the survey.
Okay, so let me go to Mr. Neeraj here. So, sir, with 82% of Indian healthcare professionals believing that AI can enable early interventions, how do you see the predictive analytics reshaping the public health preparedness and the programs as well, public health programs and preventive care delivery in India? Because I think the grassroots levels are really important, and primary healthcare is where that starts in. Yeah.
Yeah, I think we are seeing this revolution shaping in public health as we are sort of moving ahead. But just before I go there, to Bharath's point of, are we talking enough? Are we consulting enough? Yes, Philips is definitely going to do that. But AI is not something that only Philips is doing. And there are a lot of small innovators who are doing that, and the consultations are not enough. So maybe, that's an ecosystem issue that we really need to take care of, because are we actually looking at the public health algorithms when we are developing solutions? Are we sure that it's going to fit in, et cetera, et cetera? So I think those factors really need to be brought into this whole story. In terms of predictive, your question on predictive analytics, I think it's a big use case. Can we actually, so for example, in Odisha, we are now starting to use AI to predict a dengue outbreak and a malaria outbreak, which you can actually 2-3 weeks before. We're layering lots of data, and we are being able to predict. Now, what that does is the public health system can actually respond to that before the event actually happens. So that's a huge piece. In terms of our own health, Her Excellency Marisa talked about the cancer, early detection of cancer. That's a big piece, because as we all know, if you detect cancer, or if you even have a screening for cancer early, and if you get on drugs early, the chances of survival are almost hitting 100% if it's early enough, right? But if you go into late stage, chances sort of decline. I don't know if you know, but 70,000 women in India are still dying of cervical cancer. So predictive analytics is going to be a large use case, especially from an equity perspective. All of us in this room get enough. We've got the Medantas and the Apollos and all of that. What about people living in low resource settings? And how are we going to do that without technology? We need this AI to be able to start predicting where human health is going.
Yeah. Thanks a lot, Mr. Neeraj. So let me go to Dr. Ratna. While 84% of patients support more technology in healthcare, 63% are worried about the reduced face time with the doctors. is what the report says. So how should healthcare system address this concern to maintain the trust, which we are all talking about, the trust, and the empathy in AI-assisted care? It's really scary, isn't it?
So there are deep ends both sides. You know, you can't make a choice. And as Neeraj was saying, we are a country with a population that is very diverse, living in the remotest part, most inaccessible parts, as well as cities that are bursting in their teams. So yesterday I was in a co-design workshop where we were talking of 10 medical emergencies, and in the pilot, the ambulance could reach the person within 10 minutes of a call, but try doing that in Gurgaon.
Mhm.
It will not reach even in an hour. So we have unique problems, and and I'm not sure AI can address this because it goes beyond healthcare. So my question, I mean, I will come to the trust part of it, is how much can AI in healthcare just improve access? Do we need to look beyond healthcare if we have to truly improve access? And if that is the question, then do we need to go to the patient and understand what their pain points are? So reaching a doctor and getting care for STEMI might not be their biggest concern, but how to get the transport to reach to the hospital, or how to reach the right hospital at the right time, is the concern. You might reach a hospital which has no thrombolysis in place, and then you are referred and you lose that precious 1 hour. So I think more and more it is becoming important that we look beyond health to be able to address access, and from the public health perspective, that's even more important. As far as access is concerned, there are two good use examples. During COVID, we had this app that actually told you how many more people were positive within 500 meters, within 1 kilometer, within 5 kilometers. And that, you know, sort of gave you a warning that you're not supposed to step into public places, or you have to keep maintain a distance. And it was positive because it shaped human behavior in such a way that you reduced infections. Similarly, you have now models within maternal and child health, etc., where you are able to predict the risk of eclampsia, etc., and you are able to transport the mother well in time so that they receive health care. And this improves the trust in the healthcare system overall, and also improves the trust in the healthcare providers. And it's not just doctors, it's all, you know, whether it's nurses or pharmacists, it's the entire healthcare ecosystem. It depends on how the narrative is built, and if there is a positive narrative around it, and it shows consistent positive results, the trust will always be built in a positive way. About replacing FaceTime, as I said earlier, replacing FaceTime can happen for follow-up. It cannot happen for first diagnosis. You know, it cannot happen when you have multimorbidities. If it's a straightforward one symptom, one diagnosis, then possibly your AI will tell you what to do and how to do, or a telemedicine telehealth model will be able to give you a prescription. But if it's multimorbidity, aging populations, at-risk populations, vulnerable populations, low literate populations, it's not going to work. You have to go to your healthcare provider. And therefore, the trust will always have to be built with the healthcare provider, and FaceTime cannot be replaced completely. It will only be an augmentative tool.
Yeah, that's very true. And Indian healthcare system, as you all said, is a bundle of contradiction. We have the Apollos and Medantas, we have primary health centers, we have different segments and part to it. So let me go to addressing the challenges, like the trust, design, and the bias in the governance. We have all these pillars to it. So let me go to Mr. Neeraj again. One concern raised in the report is that slow AI adoption may worsen clinician burnout and increase the patient backlog. What key enablers such as digital infrastructure or workforce support must be strengthened to prevent this?
Yeah, that's actually the largest challenge that we are seeing in adoption of all kinds of digital tools. You know, we have a backbone of ABDM which has been rolled out, which is a brilliant architecture, but what is the adoption there? And how fast can we actually get there? The population is what it is. We need to, you know, deal with that. But this is actually causing larger challenges, because, you know, AI can be layered on a base, but it can't stand by itself. So is that base ready? Probably not yet. While we are all, I can tell you, we are working hard towards that ourselves as an organization. The government is at it, but until we have that in place, and we've done it in finance, you know, we have the whole UPI story, and I won't go there. But we've done it, we know how to do it. It's a question of how quickly we can do it, how quickly we can start, and then the layers will come, and that's when you'll see this really working. Until then, there is a possibility of a clinician burnout. I mean, what the report talks about is all reality which is playing out. More so in a country like ours, and probably less in a country where the population is not that large.
You want to make a comment on Ayushman Bharat, ma'am?
Ayushman Bharat, yes, but because you talked about a base, I think the base will only be strong as the regulatory systems that are in place. About the adaptation and adoption of AI in an ethical manner to be able to make that base and the pillars strong. And also, you know, in a country like ours where innovation happens in every street corner, how well do these innovations speak to each other, and how well do these AI systems speak to each other? Otherwise, it'll be just a cacophony of multiple solutions that are more confusing than providing solutions. And that brings to us, the role of a strong regulator and governance mechanisms at the national level. And as you mentioned, there is this digital health mission, there is ABDM, but and you talked about slow adoption. So how fast is our healthcare system going to adopt this? Considering that we have private and public health sector mix, with a large portion of our population actually going to the private sector, which may not be very enthusiastic about adopting this because of data sharing and other issues. Probably we have some challenges ahead that all of us need to think together to find solutions.
Thanks a lot, ma'am. Well put, yeah. Let me go to Mr. Bharath now. The report highlights that only 43% of professionals feel AI tools are designed with their needs in mind. So that is a catch there. So how is Philips ensuring that AI solutions are co-developed with clinicians you have answered part of it, for better usability and clinical impact? That is very important.
Absolutely, and this is at the core of the challenge. Yes. You have to, innovation is not about fancy stuff in a lab. Innovation is about how does it work on the field. And that way of thinking is what we inculcate in all our innovation scientists and R&D scientists. But it needs constant reinforcement. It's very easy to get carried away with something cool that you saw in a code that you wrote, something that it did very nice. However, we have it's a very regular periodic check-in that we have with clinicians about what we are working on, what the input is. I'll give you a very good anecdote. We work on reducing scan times because for many reasons, patient comfort being one of the most important ones. And when we work on this, we work on it in a way that doesn't compromise image quality. Speed without effectiveness is useless in diagnosis. So we try to marry the two. Now there is a fine line that you have to continue to kind of walk on when you're marrying the two. That fine line is drawn by a clinician, not by us. Clinician tells us that this image quality is not acceptable even if you reduce your scan time by 5 minutes. So that balance between innovation in the lab to real-world application of that innovation is a process at Philips. It's not something done ad hoc or we do on a call basis. It happens regularly. That keeps us honest. I have to also talk about a few other guardrails that we have at Philips, and I'll touch on them. First, as I said earlier, for us, it's about enabling clinicians. AI is about enabling clinicians. Second, it's about human-AI interaction, not one over the other, right? The human can always override. AI can never override. Our algorithms don't think on the field. Out in the field, and they're used. The third is to make sure the points that were said, data bias. How is your sample? Which population have you sampled? Does it have an inherent bias towards treating us or diagnosing a certain thing? I know personally that uric acid levels are different across the world. You can't have AI to say that, I have a uric acid problem in India when the level is different than it is in the West. Data, transparency, efficacy. Fourth is innovation guardrails that I talked about. And last for me and most important is cross-sector collaboration. The healthcare challenge is such that not one stakeholder has the solution, no matter who they are. And this panel is a great example of how the ecosystem needs to come together, otherwise we will do something that is not effective or efficient. So I think that's kind of the process that we adopt, the guardrails that we have at Philips. That keeps us honest to the purpose that we have.
Okay, let me go on with the legal accountability as well and the data bias. So to you, ma'am, legal accountability and data bias are flagged as key concerns in the report, and with 86% of professionals have seeking clarity on the liability. So what kind of patient safety and ethics framework should be put in place as AI scales? I mean, we are started, we can't say scaling. Yeah.
I think that's a no-brainer. I mean, with already systems in the world like the GDPR and HIPAA, we need to have similar systems in our country to protect patient interests and see that there are no data leakages or misuse of data. Having said that, we again, because we are a mixed healthcare system, how do we produce accountability in all stakeholders is going to be a major challenge. Will everybody be willing to let go of their data because it's also related to economics and market dynamics? It's a problem, and we've already seen that in the insurance sector. I mean, they do not share data, and if insurance is not sharing data, private health sector is not sharing data, just having government data is not going to help. So I think at the end of the day, we have to come up with a mechanism where there is one identity, and that identity, the patient owns the data as well as maybe the government owns the data, and nobody else has 100% ownership to that data. They can use it as long as it's for the benefit of the person for who owns that data, but beyond that, they cannot use it for anything beyond that. So that is one aspect of it, and the ethical part of it, it's a deep ocean. As I said, it could be used for marketing purposes. It could be used to drive patients to certain healthcare institutions. And to your point, for medical imaging, the AI has served well. But there are so many other fields of AI in healthcare where there are no clear guidelines, and we really don't know what is happening and how data is being used. About prejudice and bias, what goes in will come out. So for example, if you put your ECG into a chat GPT and ask you what is your disease, it will actually spew out a diagnosis. And you can't use that for any purpose unless you go to your doctor and ask them to, because there are so many other things that are required before you can actually read an ECG and find out if you're going to have an imminent heart attack. So, so if you do not have your blood workout, if you don't know your medical history, if you don't know what medications you are taking, that ECG reading is of no use at all. But then people are dependent on ChatGPT. It is actually replacing human intelligence. So I think it's a deep pitfall, and we have to build stronger guardrails than what we have right now and educate people that it is only a useful tool as long as you are using it for risk analysis and not to manage your healthcare.
I think the listeners who are joined us online must be clapping and cheering for Dr. Ratna Devi talking about the ChatGPT, because most of them go to ChatGPT first. And I've seen in my general physicians of clinic, he has put a printout saying, if you consult ChatGPT, don't come to me. So that is how it is now. So let me quickly go to Mr. Neeraj. The report also recommends cross-sector partnerships to ensure equitable innovation. Based on past experience, what models of collaboration work best for integrating AI into government or mission mode health programs? I think we have a lot of government programs, state ones, central ones,
Yeah, absolutely. And there's a before I go there, I just want to quickly say that our problem is regulation and regulatory body, but our larger problem is actually being able to enforce that. So let's not forget that piece while we are making all these rules and regulations. How are we going to enforce it in a country our size? We are not even able to enforce. If you go to a colony, a low-income colony in Mumbai, you can't even enforce the kind of doctors that are actually working there. In terms of collaboration, I think the way we look at it is we first is a government-first approach. Okay, what is the government thinking about? And when I say government, it's not the political government, but what is the country? What does the country need? Where do we need to go? What is urgent? What is not so urgent? I mean, I think working around that and working around the government systems is absolutely critical. So government needs to be in the room. The second, this consultation with the health professionals, absolutely critical. So collaboration, I mean, there are lots of apps and lots of solutions being built out there with zero consultation, with zero understanding of also the algorithms that work in a health system. So actually, you've built a solution, nice, bright, shiny object, you go into the health system, just doesn't work, right? So that's the second piece, where you really have to do the consultative bit very seriously with a lot of rigor there. And the third is, it's not about one solution. It's about the ecosystem. Are we thinking about the ecosystem as we are starting to push some of this stuff in? Is absolutely critical again. I think, I mean, we've got a graveyard of AI tools in health right now in India. I can give you a list of 100 which shouldn't be there. Maybe more than 100. Yeah, so it's absolutely important to think about the ecosystem. Where are we rolling this out? Is it even ready for it? So I think I'll stop there.
Okay. Dr. Ratna, to you. The report calls for, involving patients early in AI design to ensure alignment with their needs. How can patient groups like you play a proactive role in validating, co-creating, and monitoring AI solutions? We have more than hundreds, is what we heard just now. So that directly affect the care experiences. Do you think
100 that shouldn't exist?
That shouldn't
All right.
exist, yeah. We are becoming more specific, yeah.
That's a difficult question to answer, because involvement means that they are empowered enough to be able to contribute. So you have to start at that point. I mean, there are hundreds of patient groups in India, but how many of them are actually engaged and empowered enough to be able to contribute? So before you are able to bring them to the design table, I think the industry or whoever is building onto AI has to call them and train them, or build their capacity so that they are able to understand the topic enough to be able to contribute meaningfully. Very often what happens is there is a tick in the box in which the patients or patient groups are involved. They fill up a survey most probably, or they are called to some kind of a roundtable discussion, and that's the end of it. That's not involvement and engagement. And I often say this, and at most forums I insist on this, that yes, you call the person to the room, but did you check the capability of that person to be able to contribute? And if there wasn't no capability, then did you invest to be able to build that capability? And I think where the industry misses is on this capability and capacity building. So they want patients in the room. They say they are patient-centric. They want the patient voice, but they don't invest into building capacities of patients to be able to contribute meaningfully. Otherwise, you have a bunch of technology and science people and clinicians. The patient is overwhelmed anyway. So they will come, they will listen, they'll probably nod their heads to a few questions, and they will go away, and that is not meaningful contribution.
Yeah.
And you forgot the lunch, huh?
So let me go to Mr. Bharath now. The report also emphasizes the need for clear guardrails, which you had already touched upon. You're sensing my questions, you keep answering it before I could ask. So the report emphasizes the need for clear guardrails and cross-border regulatory harmonization. How can industry leaders like Philips work with regulators? You must be happy, or I don't know, and partners to shape a safe and scalable AI ecosystem in India?
No, this is, I think, the panelists have talked about what Neeraj and Dr. Ratna have said. Yeah. It is not about doing it for the sake of doing it, right? It's doing it genuinely. We are co-chair, Global CEOs are co-chair of Use of Ethical and Responsible AI Forum. And we work with regulators all the time. And one of the simple things I said earlier, you have to make sure when AI is out in the field, it's not learning and doing things that it shouldn't do. Simple thing, right? We take it for granted. We had a visitor from the Dutch government, and she asked a very interesting question while she was walking around our labs. She said, how does AI not become like the Terminator of healthcare, right? It takes its own life and starts doing things. So these are real questions, and we have guardrails to answer them. We continue to engage with regulators in India, outside of India, closely collaborate. Our kitchen is open for them. I mean, there is no secrets. No? We want them to see what we are doing. We want them to approve what we are doing. We want them to give a perspective on what we are doing. So we will continue to do that, because at the end of the day, as I said in my opening remarks, without trust, no technology can scale. No technology can scale. And that is fundamental in our belief. So we will continue to do this going forward.
Okay, so I've already got intimation that I have just 5 minutes. So let me, like I always have a lot of questions. I'm not able to complete it. That's my, problem. So like each of you, as I said in the beginning of the panel, represent a vital pillar in the India's healthcare system. So a technology expert, public health expert, and the patient voice. So if we are to scale, like if you are to scale AI in a way that truly earns trust and delivers impact, what is the one strategy shift your sector you think must lead today to make that future possible? Mr. Neeraj.
Like I said before, it cannot be about AI and the solution. It has to be about the health system and AI being a layer to reach a specific end. And as long as we're able to do that, it's going to have magnificent impact in a large country like ours. But if we fail in that, we're going to see a bit of trouble. Yeah.
Dr. Ratna?
I would say a good design is the beginning of any good product. So bring the patient front and center of any AI tool, and do not give regulatory approval till there is enough evidence that the patient voice has been included.
Mr. Bharath, your views?
So I'd like to re-emphasize what I said earlier, is we need to accelerate, as Philips, but also as industry, this whole ecosystem dialogue and engagement. I keep repeating, the healthcare challenge cannot be solved by one stakeholder, one body, be it the government or private or NGOs or people like eminent people on the panel. It needs all of us to come together. It's not about slicing and dicing the pie of healthcare, it's about building the pie of healthcare, and building happens when people come together. So this is what we will continue to engage in. Today is a great example. We had this diverse group for the first time in a FHI launch in India to continue to accelerate that journey.
Thanks a lot to the panelists and to the listeners. Thank you so much. One last question, if I could ask. How do you see AI, villain or a hero? Or somewhere in between? What role you want to give? Neeraj?
It's, it's like any of our film stars. You've seen them be heroes and you've seen them be villain. Okay. You have to decide where you want to place it, right?
Interesting.
Yeah, exactly, it's contextual.
You
It
can't
depends.
copy, ma'am.
No, I'm not copying. If I'm having a heart attack, maybe it's a hero because it'll tell me which is the nearest hospital. But if I am choosing an insurance company, maybe it is not a hero, it is a villain.
And where you live also. If you're in Gurgaon, it's definitely a villain right now. Mr. Bharath?
It's a character actor.
Okay.
Because it has to play the role that it is designed to play. Neither be a hero nor a villain.
Nor a villain. Okay. Thanks a lot. Thanks for the speakers.
Thank you.
Thank you.
Thanks a lot.
Thanks a lot to all our panelists. This was indeed a very insightful discussion, and from what I could see, it could go on and on. But what we could do is we can continue the discussion through the LinkedIn Live chat. There are already a lot of comments that are coming in talking about the pros and cons of AI. There are some doctors talking. There are some patient perspectives. So all those of you who are engaging with us right now, continue to do so. And our panelists will also respond back if you have direct questions for them. With that, for the closing, now I'd like to call upon Nico, the health counselor for the Embassy of Netherlands, to close the session.
Thank you very much. Some thank you words from my side as the health counselor at the Netherlands Embassy here in Delhi. First of all, wanting to thank my ambassador for setting the scene and immediately pointing out clearly the potential benefits in the use of AI, and at the same time raising some very good questions, putting the main topic of the report immediately at the core of today's discussion, which is about trust in the development and the use of AI. And I was not surprised that my ambassador called upon international partnerships in order to not only develop AI, but also to implement it together. I'm very thankful to Bharath for taking us through this international journey over the past 10 years, in fact, of this Future of Health Index, and comparing it with the experience in all of these countries, including the Netherlands and India, and how healthcare has been transforming over all these years in a leapfrog way, and especially the access to healthcare. I think that was really spot on, and I think that's the main challenge also for AI is how we can leapfrog access to healthcare for as many people as possible, if not all people. I'm very thankful to the panel and the moderator. What I liked very much is the patient centricity of the discussion that you had as a panel. As a health counselor, I thought it was very meaningful indeed. AI as an enabler, I like that very much. It's not AI taking over from us, but AI as an enabler in access to care, but in early diagnostics was also the example of the ambassador, but also in treatment and in monitoring, including telemonitoring for also remote areas, especially in a country like India. Very clear what you all stated is the importance of the infrastructure, and infrastructure including the regulatory side. But I think that Bharath made a very good point in which I think you all joined him, the importance of having the ecosystem rightly in place to reap all the benefits, but also keeping the end user in mind, including in the remote areas. And therefore, keeping the end user in mind, also keeping in mind the worries of those, not only the healthcare professionals, but also the patients, including ethical sides and bias. What I liked very much is the statement that access to healthcare goes beyond healthcare. I think that was a very good statement. It requires a lot from infrastructure, and I think Bharath added the cross-sector cooperation. I think that was a very good point indeed. In order to have these innovations really implemented on the field, making real impact in real life of the people. What I liked very much, also because that's something that we are highly engaging on with our partners in India, was the statement that I think you all made on capacity building. The importance of capacity building of the healthcare professional, because we have trust in the healthcare professional, but also of the patients and the citizens in general. In order to increase not only the acceptance, but also the scalability in order to have meaningful AI in healthcare, right? So my thanks goes to the ambassador. My thanks goes to Philips for organizing, co-organizing the event, for commissioning the Future of Healthcare Index once again for the 10th time. We're looking for the 11th report already. My thanks goes to the panelists and the moderator, the Economic Times group, and of course all the participants here on site, but also online. Thank you very much. And in conclusion, I would like to, if you allow me, to repeat the quote of the ambassador. I was very much struck by this quote, so I will repeat it again to close my contribution. As AI transforms healthcare, trust and innovation must go hand in hand to bring life-saving solutions to more patients and providers faster and with the right safeguards. As a health counselor, together with my team, this spirit will set my agenda for the years to come. And I am confident that with the right public-private partnerships, together with patient organizations, we will make this agenda come true while keeping the end user in mind. Thank you.
Thank you so much. And thanks to all of you who joined us online, as well as thanks to the live audience here. That ends our launch event for today, and continue to stay engaged through the online portal. Thank you.